Hello, everyone, and welcome, and thank you for tuning in to Health Leaders, the place for peer-sourced and solution-focused insights for healthcare executives. My name is G. Hatfield, and I'm the nursing editor for Health Leaders. Today, we are speaking with Dale Beatty, who is the Senior Vice President and Chief Nurse Executive at Stanford Health Care, about how Stanford Health Care was recently named a BCEN National Certification Champion and what that means for the organization. So, hi, Dale, how are you?
Good morning. Good to see you. Thank you so much.
Of course, yeah, and congratulations on your award again. It's really cool to see Stanford Healthcare be recognized for the work that the organization is doing. Um, so let's jump right in. What does receiving the National Certification Champion recognition from the Board of Certification for Emergency Nursing mean to you and your organization?
Thank you so much. Yeah, it's an absolute privilege and an honor. We're thrilled to celebrate the receipt of this award. Stanford Healthcare is a premier academic medical center, part of Stanford University, which is known for its excellence. And for nurses, and particularly in the emergency department, we feel a deep responsibility to make sure we elevate the practice and the outcomes for our patients within our facility. So we have a deep appreciation. Our mission is to care, to educate, and discover. And so national certification certainly helps on all three of those: to care, to educate, and discover. So the certification award is really an exemplar that really, for our organization, sustaining and recognizing the excellence that's provided by our emergency department nurses to our patients on behalf of our organization.
Absolutely. So, what are some of the positive outcomes that Stanford Health has seen that led to winning this award?
So many things have come into place. One is certainly getting staff involved. We actually have a champion in our emergency department, Marvin, that actually led the initiative of saying how important certification actually is. Our organization strives to really improve quality. In our
Hmm.
organization, we've been able to move the quality in our organization overall to a high level within Vizient compared to other academic medical centers. We also have high engagement. We're a magnet organization, and we know that engagement and satisfaction is important, not only from our employees, but also of our patients. And engagement and wellness is also important, and creating a practice environment that supports nurses and patients is critically important. And it also, quite frankly, drives financial performance, efficiency, and throughput. Doing things that are evidence based really make a difference to our patients and to our staff as well. So all of the foundation of quality, satisfaction, engagement, financial improvement, I think set the foundation for us advancing for certification and enhancing the practice environment in emergency services.
Absolutely. And speaking of enhancing the environment for patients, how do patients and also other nurses benefit from having certified emergency nurses in the workforce?
Great question. I mean, we know it's evidence based that education certification matters. We
Mhm.
know that evidence matters in our practice, and we know it produces higher patient outcomes for our patients. And quite frankly, I think brings great satisfaction to our nurses as well. I can tell you when we received the award, the just tremendous pride and gratitude. By our nursing staff to be recognized for the excellence that they bring to the organization through their certification. But certification does matter. It does bring better outcomes for patients. Education matters as well.
Mhm.
It's really important to us. And I'll just mention to you, our patients benefit too. We're number 5 in the country in patient centeredness.
Mm.
Compared to
Mhm.
other AMCs. So that's an outstanding outcome. We were just recognized by Vizient for our outstanding patient centeredness. But certification helps with that
Mhm.
because we're caring for patients in the highest level. Patients recognize that, they see it, and they appreciate it.
Absolutely, yeah. And so, from a leadership perspective, as a CNE, how do you think CNOs can create opportunities for their nurses to receive certified emergency designations and other kinds of certifications?
I think first it has to start with the values. You have to value it to understand that education certification matters.
Mhm.
I've always said I've been a chief nurse for 25 years, and I've always said when I don't see the people, that's when I want to get out of the business. And as a CNO,
Mm.
our job is to remove barriers and obstacles and find ways to support the professional advancement and development of the people that are practicing in our environments to deliver those patient care outcomes. My job is to make sure that we help bring people together to develop the best practice environment possible. I happen to be an emergency department nurse. I worked in my earlier part of my career, but my practice is dated. So my goal is always to help support those that are the experts at that bedside to elevate the practice and be the best they can very well be, and that
Mhm.
requires providing resource. It also requires having some vision
Mhm.
and creating an avenue for people to really facilitate and advance. And so I think there's lots of opportunities and ways CNOs can make that happen.
Absolutely, yeah. And apart from emergency certification, what other educational and career advancement opportunities do you think nurse leaders should be providing for their staff, whether in the emergency department or otherwise?
I think this is a critical question, and I'm a firm believer that education is important and helping
Mhm.
people. Karen Stewart, who actually is the director of the department, is in the middle of her doctorate program. She's in a doctorate of nursing practice program, and I think I can see the impact of that on the environment. Really facilitating and promoting education, formal education, and certification, and I think that's critically important. And I do think CNOs need to continue to support that kind of work, advancing. So we work with the ANCC, we work with
Mhm.
the American Association of Critical Care Nursing, certainly ENA as well,
Mhm.
and all of those are really important. I think of providing frameworks and standards to advance the development of the professional nurse, whether it's in the emergency department or broader. But again, certification matters. And so we are looking to elevate certifications, not just in the ED, but across to all clinical areas because we know it makes a difference. And then I will just say building clinical ladders so that people
Mhm.
have ways to advance within that clinical practice is important too. So we have what we call the PNDP. It's a professional development ladder that helps nurses to identify where they can grow and develop and further advance within our organization. And it makes a huge difference. So I
Mhm.
think you have to build an infrastructure that promotes professional development. And this is our highest indicator in the national database of nursing quality indicators of our nurses here at Stanford. That there's great support for professional development, and we're really proud
Mhm.
of that. And we're really proud of this award for our emergency department nurses. They deserve it, and we celebrate them.
Absolutely. Yeah. I like how you framed that about building an infrastructure of support. I think that is a great takeaway for CNOs across the country. And so, my last question for you is, do you have any other tips for CNOs or other nurse leaders about how to improve the nursing experience in the emergency department?
Yeah, I think this is an exemplar, and that is, build an infrastructure that we just talked about that creates an environment where people can flourish. So
Hmm.
we're heavy believers in shared leadership,
Hmm.
where individuals at the bedside that are doing the work are actually advising and creating and informing the work. And I do think that's important. Again, my background was in emergency services as well, but it's dated, and you need
Hmm.
the experts to be at the table. Gone are the days where policies and procedures come out to say this is how you should do things. We really need the best and the brightest, those that are educated and certified, to really build that practice environment. And so my tip would be build the best practice environment you can possibly build and use the experts to do it, and they will help you. You have to leverage the resources around you to have the exemplars flourish and for the practice environment to grow and develop.
Absolutely. Well, thank you so much, Dale, for your time. I'm really grateful to have had this opportunity to hear your insights and get to know you a little bit. And thank you so much to everyone for listening.
Thank you so much.